Risk factors for short-term recurrent intussusception and reduction failure after ultrasound-guided saline enema. Via latest results for Pediatric Surgery International. Abstract. Objective: to investigate the safety and effectiveness of ultrasound-guided saline enema to treat intussusception and to analyze the risk factors affecting short-term recurrence and reduction failure. Materials and methods. We selected patients who had undergone intussusception reduction via ultrasound-guided saline enema from January 2010 to December 2017. The overall success rate, overall pathologic intussusception rate, and pathologic intussusception rate were calculated in each group. All the patients were divided into two groups, the successfully reduced group and a failed reduction group. Then, the successfully reduced patients were divided into two groups, the short-term recurrence group and the short-term non-recurrence group. The differences between each of the two sets of groups were analyzed, and the risk factors affecting short-term recurrence and failure of intussusception were analyzed. Results. During the 8-year study period, a total of 1,793 patients with intussusception were treated with ultrasound-guided saline enema reduction in our hospital. Among these patients, 1,743, 97.2%, experienced successful reduction, 29, 1.6%, had pathologic intussusception, and 1 experienced perforation. After applying the univariate analysis and logistic regressive multivariate analysis, we found that age above 2 years and the absence of fever were risk factors for the early recurrence of intussusception. Pathologic intussusception was a risk factor for reduction failure. Conclusion. The overall success rate of ultrasound-guided saline enemas was 97.2%, and the pathologic intussusception rate was 1.6%. Age above 2 years and the absence of fever were risk factors for short-term recurrence, and pathologic intussusception was a risk factor for the failure of reduction. Add tags, currently, #medicine by Alexandros Sfakianakis, surgery, #Ola by Sfakianakis G. Alexandros.